Good morning everyone. Myself Dr. Geetanjli Chawla, Assistant Professor from the Faculty of Physiotherapy, RPIIT Campus, Karnal. Do not forget to like and share the video if you like the video, and do not forget to hit the subscribe button, and do not forget to hit the bell icon also of our channel, that is RPIIT Academics. Today we are going to learn about treatment and drugs of the DVT, of the deep vein thrombosis. So starting with the topic, deep vein thrombosis treatment is aimed at preventing the clot from getting any bigger, as well as preventing the clot from breaking loose and causing a pulmonary embolism. After that, the goal becomes reducing your chances of deep vein thrombosis happening again. Deep vein thrombosis treatment options will include blood thinners, like medications used to treat deep vein thrombosis include the use of anticoagulants, also sometimes called blood thinners, whenever possible. These are the drugs that decrease your blood's ability to clot, and while they don't break up the existing clots, they can prevent clots from getting bigger or reduce your risk of developing any kind of additional clots. Usually you'll first be given a shot or infusion of the blood thinner heparin for a few days, and after starting the heparin injections, your treatment may be followed by another injectable blood thinner such as enoxaparin or the Lonex, deltaparin, that is Fragmin, or the fondaparinux, that is Erixectra. Other blood thinners can be given in pill form such as warfarin, Coumadin, Gentoven, or Rivaroxaban like Xarelto, and newer blood thinners also may offer additional options in the near future. You may need to take blood thinners for 3 months or longer. If you are prescribed any of these blood thinners, it's important to take your medication exactly as your doctor's instructions. Blood thinning medications can have serious side effects if you take too much or too little. You may need periodic blood tests to check how long it takes your blood to clot. Pregnant women should not take certain blood thinning medications. Clot busters. If you have a more serious type of deep vein thrombosis or pulmonary embolism, or if other medications aren't working, your doctor may prescribe different medications. One group of medication is known as thrombolytics. These drugs, called tissue plasminogen activators (TPA), are given through IV line to break up blood clots, or may be given through a catheter placed directly into the clot. These drugs can cause serious bleeding and are generally used only in life-threatening situations. For these reasons, thrombolytic medications are only given in an intensive care ward of a hospital. Next one is the filters. If you can't take medicines to thin your blood, a filter may be inserted into a large vein, like in the vena cava in your abdomen. A vena cava filter prevents clot that break loose from lodging into your lungs. One can also have compression stockings. These will help prevent swelling associated with deep vein thrombosis. These stockings are worn on your legs from your feet to about the level of your knees. This pressure helps reduce the chances that your blood will pool or clot. You should wear these stockings during the day for at least 2 to 3 years if possible, and compression stockings can help prevent post-phlebitic syndromes. Lifestyle and home remedies can be taken care of. Once you receive treatment for deep vein thrombosis, you need to watch your diet and look for signs of excessive bleeding, as well as take steps to help prevent another DVT. Some things you can do include: check in with your doctor regularly to see if your medication or treatments need to be modified. If you are taking warfarin, Coumadin, Gentoven, you will need a blood test to see how well your blood is clotting. Take your blood thinners as directed, and if you have had DVT, you'll be on blood thinners for at least 3 to 6 months. Watch how much vitamin K you are eating. If you are taking warfarin, vitamin K can affect how warfarin works. Green leafy vegetables are high in vitamin K. Check with your doctor or a dietitian about your diet if you are taking warfarin. Be on the lookout for excessive bleeding, which can be a side effect of taking medications such as blood thinners. Talk to your doctor about activities that could cause you to bruise or get cut, as even a minor injury could become serious if you are taking blood thinners. Move. If you have been on bed rest because of surgery or other factors, the sooner you get moving, the less likely blood clots will develop. Wear compression stockings to help prevent blood clots in the legs if your doctor recommends them. Preventions. To prevent deep vein thrombosis, some common preventive measures include take any prescribed medications as directed. If you are having surgery such as orthopedic surgery, you will probably be given blood thinners while you are in the hospital. Your doctor may also prescribe aspirin or other medications that help prevent clots to be taken for a while after surgery. Avoid sitting still. If you have had surgery or have been on bed rest for other reasons, try to get moving as soon as possible. If you are sitting for a while, try not to cross your legs because this can limit the blood flow. If you are traveling a long distance by car, stop every hour and walk around. If you are on a plane, try to stand or walk occasionally. If you can't do that, at least try to exercise your lower legs. Try raising and lowering your heels while keeping your toes on the floor, then raising your toes while your heels are on the floor. Make lifestyle changes. Lose weight and quit smoking. Obesity and smoking increase your risk of deep vein thrombosis. Get regular exercise. Exercise lowers your risk of blood clots, which is especially important for people who have to sit a lot or travel frequently. Thank you.